I started Peptide Paradigm after I got banned from social media. I got in trouble for talking about peptides and all the benefits of them in an educational manner, even though everyone else is, but they chose me to get rid of. So I actually have two phones just to be able to have a social media account again, and it's kind of wild. So there's a little bit of censorship I have found from Big Pharma not wanting to share the benefits of peptides from Meta, and I haven't gotten too many answers other than that. That was in March. That's why I started this community where we do live coaching calls weekly. I started that about a year ago just to keep in touch with people and make sure that they feel well supported if they have any questions. I always invite everyone from the events that I host to the calls, whether to watch them after or pop on, because I feel like sometimes it's just a lot of information at those events, and it's nice to sleep on everything for a couple days and ask questions if anything comes up. So today's call, we're going to cover GHK-Cu a little deeper than we did at that event. It's one of my favorite peptides. I find it very fascinating, and it's a little different than every other peptide as far as how it works. We'll go over the FDA hearing updates, which was pretty exciting, and what that means for the future of peptides. I'm going to share two client wins that happened this week, and then we'll get into Q&A for any questions that you guys have on the live, Cindy or Randy, and then we'll go over a list of questions I got this week as well. Okay, so GHK-Cu. So GHK-Cu is the copper peptide. The GHK part of it stands for L-histidine, L-lysine. That's the GHK portion. It is a 3-chain amino acid. So it's 3 separate peptides, and then it helps bind to copper. So it's actually like a copper delivery vehicle. So the GHK has an affinity for copper, and it transports it into the cell. Our GHK levels decrease over time. So after the age of 20, we start losing a percentage of our GHK. And that's what we see outwardly with aging. A loss of skin elasticity, our hair slowly starts thinning, all things like that. So at the age of 60, most people have lost close to 60% of the GHK-Cu. This is naturally occurring in our body like most peptides. And when it's replaced, it's signaling our body for repair, recovery, and all the other things that GHK-Cu does. A lot of peptides, like we talked about the event, they are prompting, amplifying signals to the body for repair, recovery, metabolism. GHK-Cu does do that, but its biggest, most impressive thing that it does is it actually activates 4,000 genes in our body. By doing this, it signals genes not to just to work better, but depending on the gene, it works towards a repair and recovery goal. So if it's communicating with a antioxidant related gene like a SOD, it's going to tell it to work harder. If it's talking to a gene that is in charge of pro-inflammatory, like something negative, we wouldn't want more inflammation, it'll tell that to stop working as hard. So it's actually working in a way towards repair and recovery, but it depends on the gene. It's going to tell them to work on repair and recovery depending on what that gene does in our body.
So it's like what are the other things where they adapt to what the needs are, like adaptogen? Is it almost like an adaptogen?
That would be a great description of what that does. So it affects over 31% of our genes.
Wow.
And by acting on those genes, it improves how they work by 50%. So it's pretty significant what GHK-Cu can do for our body systemically. BPC 157 and TB 500 are known really well for also affecting tissue repair, especially TB 500. However, where GHK-Cu shines is it works on the cell and tissue matrices. Something it's known really well for is wound healing, whether it's from a normal wound or a laceration or a cut, but also for burns. There's studies where burns and people with really big scars have had significantly increased healing because it works on the tissue matrix of the wound healing, not just signaling like BPC 157, TB 500 to work on these certain areas. It's actually working on the healing, signaling the healing matrix. I was opening a can and sliced my thumb open. I had 9 stitches in my thumb, and I always have to remind myself which thumb I actually injured because my scar is, I can't even see it anymore. I know it was on my left hand because it was my non-dominant, but my scar is completely healed. So GHK-Cu is known really well in the aesthetic world. It's a favorite of females because it gives us these outward effects that are very noticeable. So it will increase hydration of skin, elasticity of skin, and it'll really give you a nice youthful glow. And then it also helps hair growth. Not only can it induce follicle growth, but it can also increase your hair length and thickness. But what I've personally noticed with GHK-Cu as well as for my clients is it almost has to accumulate in the system a little bit. Once it starts signaling these genes and these levels start building up in our system a little bit more, it gets to a point, and then that's when we start noticing the effects. So I say that because it takes a little bit longer for that to occur. I'd say about 4 to 6 weeks before people really start noticing. But at the moment that the body has enough of the GHK-Cu levels where you're able to start noticing outward effects, it's pretty consistent after that. So your hair will improve and it will continue improving. Something a lot of people notice, including myself, is I have to cut my nails all of the time. So all these little things that kind of show me that it's working. My hair definitely, when I started GHK-Cu, I had that postpartum hair growth look where I had all these like baby hairs in my hairline, which I wasn't like super happy about because I had just gotten through that with 2 little boys because it's just such a weird such a weird thing. They've all grown longer now. But I again didn't really love that because my hair's in a ponytail all the time. However, it definitely showed me that it worked for me.
Is this the one that you want to be careful of if you have a family history of skin cancer or cancer or anything, or is that a different one?
This is in that group. So yeah, any regenerative peptide, including BPC 157, TB 500, GHK-Cu, and then also any of the growth hormone signaling peptides, they all are working on essentially proliferation of cells, regeneration of tissues. So whenever we have that, there is a risk that if you're injecting near an area of cancer, that it could also proliferate those cells. There are more and more studies coming out that show some of these regenerative peptides, including BPC 157, have such an effect on lowering inflammation in the body that I can't say like these don't proliferate cancer. However, there is more and more science that will be coming out more on that side of things. But for my clients who have a history of cancer or are just worried about it, something that you can do is you can always go get a cancer screening. I get one at the fire department every year, but it's also something that you can just go and get a blood test for. So a lot of my clients, just for peace of mind, they've heard all the possibilities and negative things that could happen with peptides, and that's been keeping them from trying them for healing. Like, let's address that. Let's just get a cancer screening one time. It is a little bit of an investment, but if that's the one thing you're worried about, then let's figure that out. GHK-Cu works really well healing overall. It's a great complement to BPC 157, TB 500. So BPC 157 lowers inflammation signaling, will also create what's called angiogenesis to these areas that need healing. Once that occurs, and then TB 500 helps with cell and tissue migration. If we add in GHK-Cu, again, it activates all those recovery and repair genes, but also works on that tissue matrix healing. So it's a great complement to anyone who's looking to heal and accelerate healing of an injury.
Would this be appropriate for gut lining or permeability issues, or is that a different one?
It's definitely not the best one for that. There's two peptides that work really well in the gut, and my number one is KPV for the gut because it will actually regenerate the gut lining. And then BPC 157 is actually made in the gut, and that can also be really beneficial. I normally don't recommend oral peptides. However, if you have gut issues and you want to take BPC 157 and KPV together for a specific goal of working on inflammation in the gut, then BPC 157 is very effective in the oral capsule form.
Oh, interesting.
Mhm. Okay, so there are some things to talk about with GHK-Cu. First thing before we go over side effects, I'd like to cover just who it's for. It's great for really anyone. The reason that we see the outward effects that are so powerful and loved for like a skin glow, anti-aging, all the things is because it's so beneficial for just healing on internally. So one of the things that some people experience, and this does not happen to everyone, but there's something that is called the GHK-Cu uglies. And this
Mm.
happens because GHK-Cu induces collagen so well, it kind of forces your skin turnover with collagen to like more than it's used to. So with GHK-Cu, we see that with increase in collagen production. And what that looks like, it happens about 2 weeks after starting therapy. And it looks different people, but it could look like a little bit of redness on the skin. It could look like dryness. Personally, I did not experience this, but it does happen in probably 10 to 20% of people will experience this. If you are starting at a pretty conservative low dose, this will not happen. If you are starting at a higher dose, this could happen because it kind of makes sense. If you're taking a high dose and it's prompting this heavy signal of inducing new collagen production, and your skin is pushing out all this old collagen production, that's basically what those GHK-Cu uglies are. I personally, with the LEMD dosing, have not had any clients experience this. So it is a pretty conservative dose, but it's moderate enough where you're still getting those skin, hair, and nail effects. LEMD is the provider that I primarily work with for
Oh, okay.
peptides. So the dosing is done by the doctor. However, the way that
Oh, Ellie.
Ellie,
Okay, I
yeah.
thought I
I
got
know
it.
even when
Okay.
yeah, sometimes when I say it, people get a little confused. So yeah, the LEMD, the
Yeah,
way that they do the dosing is again, it's conservative, but it is still enough to notice the positive effects of GHK-Cu.
got it.
Another big thing is probably 30 to 40% of people will notice that they have a little bit of a sting or a burning sensation with injection. So there's different ways to kind of work around that. Some people tolerate it and it's fine. For others, it's not something that some people will, if they had no other option on ideas on how to help tolerate that, like they just wouldn't take it. It's that strong of a sting. So
Mhm.
it affects everyone different, and some people don't notice it at all. There are ways around this. So one thing is the concentration. So if you were to get this in like a CLO compound where it's actually part of a peptide with three other compounds, yes, the GHK-Cu is still the full dose. However, it's diluted enough in that syringe where you won't get the sting like you would if you just had GHK-Cu on its own. So if someone just orders GHK-Cu on its own and is experiencing the stinging, they can order a vial of bacteriostatic water. And they can actually pull up some of the bacteriostatic water into that syringe. That way it's diluted. You can leave that syringe on the counter for 10 to 15 minutes, let it get to room temperature, and then go ahead and inject it. I always recommend rotating, but if you're having the experience of stinging or burning in, for instance, the abdomen area, you can rotate and try different injection sites that may not be as sensitive. So my number one direction for people is to go to the glutes. So turn to the side, grab a chunk and inject in your glute. And most peptides are metabolized a little bit slower back there. There's a lot more they have to get through. So sometimes people will have a mild reaction or a burn or a sting if they go to their glute. I'd say that solves 80% of the people's problems. So that'd be the first thing I try before actually diluting the products yourself. Here's some ideas on how to reduce the stinging.
Or are there any other peptides that you would recommend doing this with? Like as far as like my husband's going to start taking the 157. Are these the same tips that would apply for that if he needed to accommodate or change anything?
Yeah, I don't think it'll be necessary though. So
Okay.
the GHK-Cu, it just has this sing to it because of the copper ions. The movement with the injection site definitely applies though. So if he has a little bit of mild irritation, whether that looks like a little bit of redness, some people get a small bruise, that's pretty rare. But if anything like that occurs, he can go to the glute, or even you could help him inject in the glute because
Okay.
it'll be metabolized slower. That solves most people's issues if there is any mild irritation.
He won't have any issues. He never does.
So last week was the FDA hearings for 7 peptides. And what
Yes.
they were talking about was a group of peptides that were on the category 2 list and approving them to move to the category 1 list. So is this FDA approval? No, but it is basically a stamp of approval to be able to compound these peptides at a 503A compounding pharmacy level. So a lot of people ask the next question, especially if you order through Ellie, is how have I been able to get these peptides already before this happened? If you have a peptide on the category 2 list, like BPC 157, TB 500, or GHK-Cu, the category 2 list basically just means you can compound them, but it's essentially like at your own risk. It's just not recommended. So that's why these compounding pharmacies like LEMD can still compound these because 503A means that they're being compounded for one person. It's a prescription for Gina of this compound dosed by this doctor. So that's why, LEMD isn't doing anything illegal, but they're just making sure they check all of the boxes, going through a doctor, tracking everything, doing appropriate dosing to be able to still offer that to their customers. So now that all of these peptides, 6 out of 7, are on the category 1 list, it basically just allows more access for the 503A compounding pharmacies have to these peptides. So the peptides that were approved were BPC 157, TB 500, KPV for gut inflammation, and just overall lowering systemic inflammation, priming the body. MOTS-c is great for metabolism. It's a mitochondrial peptide, so it increases mitochondrial health. Great for fat burning. A lot of people on a GLP-1 will add in MOTS-c, and it's nicknamed an exercise mimetic because it signals the same response as exercise would in your body. Epitalin is great for sleep. It's great for healthy aging, longevity. This is a peptide that you actually take for about 10 days every 6 months, and it helps lengthen the telomeres. It's very popular, one that I have not tried, but I'm hoping to soon. And then Max is amazing for just focus, mental sharpness. It's a cognitive peptide, and it's also a mood booster. A lot of people will end up taking this, and it's a great tool to help people get off of antidepressants and things like that.
And the one they didn't approve, the DSIP, I think it's called.
Yes,
What?
which I was kind of bummed.
Yeah.
I really like that one. It's one of my favorites. And so these were all being approved for specific reasons.
Like, why do you like DSIP?
So DSIP stands for delta wave sleep inducing peptide.
Oh, that's right.
Yeah, it's been wonderful for my sleep, which I don't get a lot of. It just improves the quality of the actual sleep that you get. It directly acts on deep sleep. It's not something that's going to help you fall asleep, which I know a lot of people have trouble with, but it is something that could help you get through the night. So a lot of women wake up at between 2 to 3 a.m., especially if you're in menopause. So that's something that could help with that. Or if you're waking up not refreshed, this is kind of my go-to, and it helps really well with nervous system balance because it's just aiding your quality of your sleep so well.
Mm-hmm.
Having these peptides go to the category 1 list will just mean that we get more research, more studies. There's going to be more transparency with these. And the biggest thing is going to be improved access, which will equal improved safety. So if people have more options in the pharmacy grade world, it will give them better options to not have to find something on their own in the research grade world. Some client wins after checking in with a couple people this week. This is a female firefighter. She started a GLP-1 it's just been 2 months, a little over 2 months. And she said to me, I didn't really even realize how much help that I needed, but her body responded so well to a low dose of tirzepatide. And within those first couple of weeks, she saw reduced inflammation, increased energy. It allowed her to be more consistent with her efforts of eating right, working out. So I always like to share non-scale wins. So she had some work uniforms that she could barely fit into, and now she finds that they're slipping off of her. All good things. And the biggest thing is it helped her with alcohol. So because of the GLP-1's actions in the brain affecting the reward and the dopamine pathways, it is a lot easier for people to form new habits while they're taking tirzepatide or retatrutide because it will help any new habit become more concrete. For her, it was avoiding alcohol. So you'll find that you don't, because it's working on those reward and dopamine pathways, you don't get the same like positive reinforcement. A lot of people go to alcohol for like downshifting the day or as like a reward and something they look forward to. And they get this like positive, dopamine response. GLP-1s will help kind of mute that a little bit. So if you stop getting that when you're reaching for alcohol on your days off or every night, it's a lot easier to not go to that, which is pretty amazing. And obviously alcohol is a progress blocker, whether you're looking to lose weight or looking to repair an injury.
And that was the tirzepatide for her?
That was tirzepatide.
And that's like a combination of multiple ones, or?
So tirzepatide is a dual pathway GLP-1. It's my personal favorite GLP-1 for working with females or anyone long-term because it does have the GLP-1 pathway benefits that work on appetite, reward centers in the brain, as well as digestion. And then we have the GIP pathway, which works on hormone regulation, blood sugar, and inflammation markers. Next client, this is a 62-year-old female who lost a significant amount of weight on tirzepatide. And when she got to her goal weight, she really wanted to be like the strongest version of herself. So she shared her in-body with me recently, and her goal is really just to maintain body fat and gain muscle. So this is her in-body. So this is in December, and this is in July. And you can see that her weight is basically varying by about 6 pounds, which is totally normal, but her muscle mass is slowly increasing. We kind of peaked here in April, but it's only varying about 1 pound. So her goal is to just continue increasing lean mass as she ages, and she's doing a very good job of that. She's gained over 3 pounds of muscle since December, and that body fat is averaging at about 10.5%, which is great. So this just shows what putting in the effort of nutrition, focusing on protein, and strength training can do for you even later in life. Okay, so questions. Cindy, do you have any questions right now?
So when you talk about each one that got FDA approved or whatever, or okayed, those are all like specific names, but then you see like Ceremolean or some whatever, and those other, like, what does that mean? Those are like the stacks, I guess they're called different? Because you didn't mention Ceremolean or whatever it's called, sorry.
Okay, so for the FDA approvals last week,
Yeah.
or not approvals, category moving. So there are some peptides that are FDA approved. Last week, they only went over 7 peptides. I will say Sermorelin is one that is already FDA approved, and then NAD is as well. So there are some that are FDA approved. There's some that are on the category 1 list now, and there's some that are still on the category 2 list.
No, I guess what I
And
mean is Sermolian, is that an actual peptide or is that like a combination of a bunch?
Sermorelin is just one peptide.
Okay, that's why you didn't mention it because it wasn't one on the list of the ones they were talking about.
Correct. Yeah, Sermorelin is just one peptide. That one specifically is already FDA approved. So that's one that you'll see that a lot of compounding pharmacies already have.
Mhm. And then is this FDA categorization going to affect LEMD as far as like their process or anything that they do?
No, I think if anything, they're kind of ahead of the game. They are first to market with a lot of the category 2 peptides.
Mhm.
So, if people were kind of waiting to see like, oh, BPC 157 is moved now to the category 1, I'm more comfortable ordering that. Ellie is somewhere that they can go to order it. So
Mm.
if anything, it would just create essentially more competition down the line for Ellie, but they are in a very unique place where they have the raw materials, APIs of the peptides being made in the United States already, which is a
Mhm.
very like hard thing to accomplish for a lot of telehealth pharmacies. So I'd say that's one thing to look for as we see these other telehealth options popping up is like, okay, yeah, they're compounded in the United States, but where did they actually get that product? Because most likely it would be coming straight from China and being processed in the United States.
Mhm. Well, I guess the only other thing is just like kind of fine tuning what I think I might be looking for. So that's more personal as far as like questions go.
I mean, I do these basically a lot of times for people. So if you are more than welcome to share and ask questions for your personal situation if you're comfortable. And if you're not, that's totally fine. I do have a list of questions that other people have asked that I'll answer as well. So that's totally up to you.
I mean, go ahead and do that and I'll think about what
For
I
sure.
need.
One of the questions I got this week submitted was, what is better for increasing lean muscle mass, Sermorelin or Tesamorelin? And there's a couple different things we look at to find the best compound for that person. And it not only depends on the compound, but it depends on that person's habits. So Sermorelin is a great tool for increasing lean mass, increasing recovery. It actually increases bone density and it increases sleep, deep sleep. There is still, anytime you have a effect on increasing growth hormone, it will increase the quality of your sleep. So Sermorelin is great. I love it for anyone who is going through menopause because it does have that effect on bone density. I love it for any female who is active but does not actively lift weights. So it's a very nice, gentle promotion of growth hormone. This is something you take at night right before you go to bed. And I say that because tesamorelin acts about twice as effectively on growth hormone, specifically for lean mass. So if I have someone who is actively lifting weights, strength training, we will see a stronger effect from tesamorelin for them, specifically on lean mass. So they're kind of two different categories. Some people will use both, never at the same time. You would never do both at the same time because there's activating different pathways. However, it's kind of you're ending up with the same goal. I do have clients who love Sermorelin and they'll do the 3-month duration cycle on that, and then they'll go over to tesamorelin and they'll kind of just keep cycling those between those two. Tesamorelin with LE is compounded with either KPV or ipamorelin. So tesamorelin with KPV is going to have an effect more on the abdominal cavity. So tesamorelin specifically can affect abdominal fat, lower abdominal fat, and visceral fat, and KPV affects that gut lining. So we're seeing lower gut inflammation, lower bloating. And then we also have tesamorelin that's compounded with ipamorelin. So this will be a dual effect on growth hormone. What ipamorelin does, it affects what's called IGF-1, which will increase lean mass quite a bit, but you will also see an increase in water weight and a little bit of bloating. So this is something that affects some people more than others. It is very effective for increasing lean mass, but we do see that effect on water weight and bloating that most females aren't crazy about. It is something that doesn't stick around forever. A lot of people will get through that over a couple weeks. But a lot of my clients are having good, sustainable progress on a GLP-1, and if they go to tesamorelin and ipamorelin and they have all this water weight, they're not super happy. So that's why I really like tesamorelin KPV. Another question that was asked was, where is the pharmacy for your provider? So the LEMD pharmacy is in Texas. It's called Clover RX. It is the standalone pharmacy for LEMD. Do they do third-party testing? Yes. Any 503A compounding pharmacy has to do COAs and third-party testing per batch. So 10% of each batch of a 503A pharmacy or more has to be tested. So a lot of times if you go to a 503A compounding pharmacy like LEMD, they won't send you a COA because they want to send you the correct COA. So once you order, you can ask for the COA that's attached to the certain batch that you ordered. There are no additional telehealth fees for LEMD, which is pretty unique. A lot of the other telehealth sites will have like a monthly fee or a initiation fee. You're just paying straight for the peptides prescription with Ellie. What is the tirzepatide microdose? This would be with LEMD. And what if that is too low of a dose, but they don't want the weight loss dose? So that's a pretty good question. So Ellie offers a tirzepatide microdose, which is 2.5 milligrams. And this is a 12-week duration. So it's 2.5 milligrams per week. The weight loss dose for tier 1, which would be the first 3 months, is 2.5 milligrams, then 5 milligrams, and then 7.5 milligrams per month. So if someone is looking for more than the microdose dose, but they don't want to commit to the weight loss dose, I would say as long as they have good habits, so solid concrete habits, they're eating their protein, they're strength training, but their body's not responding to that 2.5 milligrams, I'd say the best option is to invest in the weight loss dose, but know that you won't follow the standard dosing. So let's say you want 3 milligrams per injection, and that's like your sweet spot dose that you found. So you know you don't want to do the microdose, it won't be enough for you. You can buy the weight loss dose for Ellie. It'll last you a lot longer than the 3 months. You're getting a total of 60 milligrams. If you wanted to plan on 3 milligrams a week, for instance, that peptide amount would last you 15 weeks. My biggest thing with tirzepatide is just being able to, you're pulling up your dose with Ellie or with anywhere you're ordering from. So I like to empower people to know that they don't have to go from 2.5 on month 1 to 5 milligrams. There's absolutely no need for that. If they're looking for a little bit more of a response from their body, and again, we're seeing solid lifestyle habits, you can go from 2.5 to 3 milligrams. We would just have to make sure that we do a little math and you're pulling up the correct units. For the recent changes, 1, it's going to take a while to see these changes, and 2, insurance likely won't cover any peptides until they are fully FDA approved, and that it will take a long time for that to happen. So long story short, no, unfortunately. Ellie does accept HSA and FSA funds, so that is an option for people with Ellie, which is really nice. Best peptides for cold sores, that would be thymosin alpha 1. Thymosin alpha 1 modulates the immune system. So anytime we have like an autoimmune condition or something like a cold sore issue, herpes, anything like that, it will help manage those flares because it's going to bring your immune system back into like a normal balance, and it's going to help control any sort of autoimmune flares. It's very good prophylactically for not getting sick. I know there's a couple people who have ordered it to have on hand because their family members are having the montezumas or the diarrhea issue that's going around. And I talked to someone on the phone yesterday who used it because her son was sick like that and she was able to avoid it. And best peptide for nervous system support. DSIP is great here if sleep is an issue and that's affecting nervous system, but overall, I always recommend Selenk, which is a nasal spray. So anytime someone is just feeling like they have a lot on their plate, overwhelmed, any sort of hint of anxiety or anything like that, Selenk is great to have either on hand as a tool or to take as prescribed daily. It's an amazing tool. It's one of the most prescribed. They call it a pharmaceutical in Russia. Selenk and C-Max are extremely well known over there. There's a lot of science that supports how well Selenk works on the nervous system. Selenk was used for 2 weeks as one control, and the other control was a benzodiazepine. That would be a prescribed medication for anxiety management. And it showed just as great effects as that same benzodiazepine. So I do think that in the world we live in, even as a firefighter paramedic, we go on anxiety calls all the time. And I used to kind of like, when I was younger and a lot meaner, I would be like, now that I'm older and nicer and I've worked with a lot of other people, it's out of people's hands to have a tool to help support people through that and potentially even make some change in that issue for them. I think Selenk is a great tool. I'll put it in the chat here. It's Selank.
Got it. And so what do you think about somebody with like an autoimmune disorder that's not like the thyroid situation?
Like the Hashimoto's?
Yeah.
So for Hashimoto's, what we see works the best is tirzepatide at a low dose, like the microdose. Works really well with anyone who has Hashimoto's, is dealing with flares. And since it does directly affect the thyroid, as long as there's no history of thyroid cancer, tirzepatide is the best tool to help manage that. It is something that women who have Hashimoto's, they have so much relief with it that they'll tell you straight up, like, I will use this as a tool the rest of my life because it makes me feel like that much better. And their physique completely transforms because their body starts working again. It is a pretty amazing tool. But the nice thing with the microdose of tirzepatide is my direction for people with that, whether they have an autoimmune or not, is to start at about half of the dose and slowly work to find a dose where your body is responding and you're noticing effects. So the goal is to find the lowest effective dose for that person.
How do you manage that and then like not adjust your medications? Because you can't just like change your medications without getting lab work and stuff. You know what I mean?
I'd say the biggest medication issue, not issue, if anything, it's a good thing because it shows that your body is starting to work again, would be for a lot of my clients who are on like a synthroid. They'll go on tirzepatide, and as their metabolism starts working and all the dots are being connected again, they'll start noticing that these doses of synthroid that they're on are causing some side effects, like heart palpitations would be the biggest example that I've seen. And then they'll go back to, well, if they're able to lower the synthroid dose themselves, they'll do that. But my direction would always be to go to your primary medical doctor, explain the situation. You can, support your case to your doctor too with blood work, and likely something would be reflected in your blood work positively as well. And I think there are enough cases in science out there where, most doctors aren't going to be like, well, you need to get off of this tirzepatide if you're having, if you're having side effects from a prescription medication because it's too much, it's a good thing to go lower your dose.
I mean, basically, I just feel very pudgy. Like, it's just like I've gained so much weight. And I still have all my thyroid symptoms. Like, I'm still dry and like, all those other things. But supposedly it's like under control, but it's like, am my metabolism is not, I mean, I know I'm in perimenopause, I get that part too, but I just don't build muscle. I'm pudgy. I don't like it.
Yeah.
So,
Well, and at that point, you have a lot of things working against you.
mm-hmm,
Yeah, if I was in that situation and were to try just one thing to start with, it would definitely be like a low dose of tirzepatide. Something where I still had an appetite, could still support my body, but that's going to just help lower inflammation and help kind of correct some of those fat patterns that come along with perimenopause and
mm-hmm,
things like that. And again, the biggest thing isn't even just physique, it's like just feeling yourself again mentally is
mm-hmm.
the biggest thing that we see with a lot of autoimmune conditions.
Yeah. Mm.
All right. Well, do you have any other questions that I can help with? I think I finished all of the submitted ones.
So just the tirzepatide seems like a good option, but then what about the thiamosine, whatever? Because that kind of manages the cold sores. Isn't that like autoimmune thing too?
It is. They just work in different ways. Tirzepatide would work more on metabolism and lowering inflammation systemically from brain to body. And then thymosin would come in and help work in a more targeted manner
Mm-hmm.
directly on any inflammation that was left from that autoimmune condition. So they definitely would both have their place. However, just picking one, I think you'll see better systemic effects from the tirzepatide. And then if you were to add in thymosin alpha a little
Mm-hmm.
later after the body is almost primed from lowering systemic inflammation so well, you'll see better results from the thymosin.
And the tirzepatide versus the thermolazine, or however you say it, with the KPV.
Oh, tesamorelin with KPV. So
Yeah.
that's going to, I think that's something for you like that would come in later, right? Because
Mm.
that would be a specific goal of
Lean.
reducing, working on the gut, but also increasing lean mass.
Mm-hmm.
And a lot of the times, I mean, priority wise for you, I would look just from hearing what you've said on the call, I would focus on things to lower inflammation and work on your physique and just feeling like yourself again. And for
Mm-hmm.
that, it'd be more of the tirzepatide, honestly.
And then do you have to be on it forever to maintain the results, or does it just activate your thyroid to kind of start working on its own?
It's tricky with Hashimoto's because
Mm-hmm.
Hashimoto's isn't something that you can cure, but it is something that you can manage. So, what I see with a lot of women who have Hashimoto's specifically, who go on tirzepatide and have great results, is they find that dose that works for them, where their body's responding, and they take it until at that certain dose to where they're happy with their physique. So once they get fat loss in these, certain amount of fat loss, they're happy in the mirror and they're feeling really good from the cognitive effects and things like that. At that point, then they will titrate down the dose to a dose where they're still experiencing the effects of tirzepatide on the inflammation that they were experiencing and on to also still enjoy those cognitive effects, but they're not necessarily using it for body composition anymore. So a lot of women will still use it to manage Hashimoto's at a low dose. I mean, no one wants to be on these for forever, but for a autoimmune condition like that, it has been such a powerful tool for women to manage it that once they are able to manage it and feel like themselves again, they find that low dose that they respond to. It's like, okay, I'm pretty happy where I'm at,
Mm-hmm.
and you're in control. So you can titrate off and you can kind of see how your body responds after that. Depending
Mm-hmm.
on how severe your Hashimoto's is, yes, you might get your metabolism working again
Mm-hmm.
to where like you're happy without it. Or maybe it's something that you want to cycle on for a little bit and then cycle off.
Mm-hmm.
So one of my favorite things to do is cycle off of things like tirzepatide and some of these other peptides that I enjoy because then I notice the positive effects that it was having.
Got it.
Yeah.
Okay. Well, thank you, Gina. It's been very informative. I hope people enjoyed listening to my questions.
This is exactly why I do this. So I appreciate you asking questions. I'll post this recording in our group.